When we look at high blood pressure, for starters, the reason why people get high blood pressure, we'll call people say essential hypertension, meaning we don't know what causes it, but we do have a pretty good clue to all the different things that can cause high blood pressure. Vascular, meaning over time, if there is abnormal blood vessels, we get plaque in the blood vessels get hard, they don't relax, lack of nitric oxide, that causes the blood vessels to contract, leading to high blood pressure. If we have a damage to our kidneys or poor blood flow to our kidneys, the kidneys secrete hormones to turn on retention of water, retention of salt, because they want more blood flow towards them, which results in higher blood pressure because you're taking that, if you think about a fire hose and filling it full of water and making it very taut, the pressure in the hose would go up as opposed to being very relaxed. Salt obviously will cause the retention of water. So if you eat a high salt diet, your body, we can't turn your blood to salt water, so you have to retain water to dilute it out so that you have the appropriate viscosity of your blood. But salt's also a direct toxin to the blood vessel wall, so it becomes more stiff, so it can't dilate and constrict. Again, our whole body, if you think about a little kid, everything's so pliable. They bend, the blood vessels, everything is very rubbery and taut. As we get older, everything stiffens up, so we want to have a lot of movement to be able to dilate our blood vessels and constrict our blood vessels. And then the last etiology of high blood pressure is the autonomic influence. So when people say, well, I have white coat hypertension, they blame the doctor. Well, you may blame my white coat, but it's actually your autonomic nervous system that is firing when you see my white coat, or you think you have to go to the doctor's office, that triggers this sympathetic outpouring that causes the constriction, the higher heart rate, the higher blood pressure. So when you get nervous before or fired up, so some people, my ethnic heritage is Italian and Irish, so it's like the perfect storm combination, right? But in reality, my mother's very fiery, very sympathetically driven, and my father was actually more parasympathetic, very calm, cool, and relaxed kind of guy. Depending on your personality and your life experiences, a stock trader may be sitting up in that sympathetic tone most of their lives. So we start to drift to one end of this sympathetic, parasympathetic scale, and before long we lose gears. We lose our ability to get all the way parasympathetic or all the way sympathetic, where and most people live up in this high sympathetic tone. We have increased screen time, people worry, there's always some stimulation, there's just never quiet. As some of I was in Houston for the weekend with the ice storm, and we were without power for 40 hours. And when the power goes out, and we didn't have cell service, so we lost all of those conveniences that we looked. And there for a little bit, all we did was look at our phones, waiting to find some sort of feedback on what was actually happening. And you watch that little wheel grind and grind and grind, and nothing was happening. And finally, it's like, you might as well the only thing we're doing is wearing down a battery to something that's not working. So there we are, in this very quiet house, all of a sudden, what do? No TV, no internet, no communication. And so all of a sudden, you realize just how much input you're getting all the time. And, it took a while for, everybody to just kind of settle down and, relax into the moment. And, it comes again from where people live. Do they live more sympathetic, or do they live more parasympathetic? And, how easily can you turn on and turn off? So if we look at it on this autonomic nervous system, which the vagus nerve is the nerve that's really supplying that area, when we think about a sympathetic nerve, there's a, I think about it as a, a string. So on one end of the string, we have the sympathetic system, and on the other end of the string, we have the parasympathetic system. And we should be able to go along this string in our day-to-day lives. So if, you see a rattlesnake when you walk outside your front door, you want to run the other direction. So your blood pressure goes up, your heart rate goes up. We shunt blood away from our digestive system. If you get an infection, you get a fever. The inflammatory response is stimulated by this sympathetic nervous system. Your heart rate goes up when you have a fever. Typically, your blood pressure will go up if you have a fever. Again, you don't have an appetite because you have less blood flow going to your digestive system. So that's why, inflammation, people lose their appetite when they're sick. On the other hand, if everything is really good and you're nice and relaxed and we're activating the parasympathetic nervous system, our heart rate goes down, our blood pressure goes down, inflammation goes down, we're digesting better. So, you can eat, people that say, oh, I got all worked up and I ate and I got sick at my stomach, right? That's because their sympathetic system, they didn't have any blood flow to their stomach. If I'm running a marathon, I can't eat a pizza because I'm not having a lot of blood flow to my stomach because my sympathetic system is activated more and I'm shunting blood away from my digestive tract. So depending on how we breathe, we also can activate these autonomic nervous system. So the first thing when we talk about breathing, obviously it starts with your nose. Now you can breathe through your mouth or you can breathe through your nose, but typically we're meant to eat with our mouth and breathe with our nose. And so when we start to breathe in or sniff in through our nose, it actually causes the release of nitric oxide. And many of you know nitric oxide is something that causes the endothelial cells to actually dilate. So when we take a breath in through our nose, we actually generate nitric oxide to actually make our bronchial tree dilate. So right then and there, that actually improves respiration and blood flow and oxygen by breathing through your nose instead of your mouth. Now, the problem is that when you breathe through your nose, if I look to the side, it's a distance, so 3 or 4 different inches from my nose to my mouth. So, and it's obviously breathing through my sinuses. So it takes more effort. If I breathe through your mouth, that's why when you start to run or exert yourself, all of a sudden you breathe through your mouth because it's easier to get that breath in than to breathe in through the nose. And sometimes we can become very lazy. Sometimes people actually have some mechanical changes in their jawline that their tongue actually hangs to the bottom of their mouth as opposed to resting behind your upper teeth. And so that weight of the jaw or that excessive breathing from the mouth over years ends up causing a jaw drop to people. And they don't breathe through their nose. And so again, use it or lose it. People say, well, I can't breathe through my nose because I have a deviated septum or my nose is already stopped up. Well, part of that is because you're not using it, so it closes down. If you're not using it, it's like the back room or a back closet, it's shut off from the rest. It gets cold. You're not using it. So breathing through your nose actually takes practice and it takes a little bit more effort and it uses more muscles of your chest. And that's the other thing that people don't do. So most people breathe very shallowly and very often and overbreathe, so to speak. So you'll see people breathing just from the upper portion of their chest, and they never actually use all this lung that goes down to our diaphragm. So they're just breathing in and out, these tiny little in and out, in and out, in and out, in and out. And you can maintain your oxygen saturation just fine. But what happens is by breathing very frequently, we start to breathe off carbon dioxide. And by breathing off carbon dioxide, then it changes our whole physiology. And we'll get into that more and more as we go. So what we want to do is start to use respiratory muscles, and the main one being the diaphragm. So the diaphragm sits right at the bottom of your rib cage. I'm going to show you a picture of it. And so when you initiate breathing from your rib cage or your diaphragm, then all of a sudden you're pulling down and drawing air in as opposed to just breathing on the top. The other respiratory muscles are the muscles between our ribs. And then the other, and then the secondary muscles are these neck muscles that we use, when people get really tired. So if you see somebody at the end of a race or somebody that's in respiratory distress because of heart failure, they're using these top muscles because they've actually worn out the muscles between the ribs and largely because they haven't used them.